Arthritis at Home. On today's episode, we're pleased to be speaking with Dr. Zahi Touma. He's a scientist at University Health Network in Toronto. Dr. Touma's research focuses on outcome measurement, particularly for lupus, SLE, including the assessment of lupus disease activity and quality of life. Dr. Touma, welcome to our show.
For the introduction as well.
Now, to get started in that brief bio, your focus on outcome measurement. I'm not sure if everybody in our audience will understand exactly what you do every day in terms of your research and scientific advancement. So maybe to start, just tell us a little bit about that type of work.
Exactly. So, it's something that probably all of us, we utilize in every task. So it's all about measures. And always you will know more about something if you're able to measure it, whether in centimeter, in inches, if you're measuring your temperature. And this is what we do with lupus and other rheumatic diseases. So when you see the patient and we talk about how active is the lupus disease activity, you need a measure instrument to kind of say you're very mild or severe disease. So that's type of measurement. At the same time, we get what we call the patient-reported outcome. So we ask the patient to fill different instrument, whether online or copies, and this is all about measurement. Now, why it's important to standardize this study, and I have a study where when I compare the results, it would be important that we both are speaking the same language in a standardized fashion. And that's what we do as well with clinical trials to get new medication for lupus. We need similar instrument. So that's kind of brief introduction.
Thank you for that. Now, we know that you were attending the CRA's annual meeting, scientific meeting, and you had a presentation, and it was related to the work that you're doing, but in particular, your presentation focused on advances in treatment and therapy for lupus. Now, our audience knows from our website and from our education series on different disease types that there's roughly 15 to 20,000 people in Canada living with lupus. And we know, and we've talked to experts like yourself about how tricky it is, the diagnosis of lupus. I think what we want to talk today about is after diagnosis and you have access to a specialist and you're starting to receive treatment. Well, a lot of lupus patients quickly understand that the options, let's say for a rheumatoid arthritis patient who has many treatment options, it's not the same case for a person living with lupus. The options are much more limited. In fact, there was an advancement, the first biologic approved for lupus just a few years ago. So I think our audience would be very interested to hear on the landscape and how that is changing. Certainly ACE visits not only the CRA annual meeting, but EULAR and the ACR. And certainly over the last 10 years, we've seen an incredible momentum around advancements in lupus research. So we'd be very interested in hearing some of the key takeaways from your presentation.
So it's exactly as you have mentioned. Lupus, it's also named as the disease of thousand faces. So really often there are probably no two patients similar in terms of presentation. Some of the patients present with skin, other with inflammation in the kidney, we call it lupus nephritis. Other patients can present with central nervous system manifestations such as psychosis or cognitive dysfunction impairment. Or arthritis. So really the presentation is very heterogeneous, different from patient to the second. And part of this will dictate the choice of the medication. Now, we have had a very challenging road to validate, to approve a new medication for lupus. And lot of our medication that we use, they're not they haven't passed the clinical trials in lupus, means the trials were negative. But it took us almost 50 years to have a new medication approved for lupus, which is belimumab or Benlysta. This is after probably more than 20 or more of negative randomized trial. And it's been definitely, as you have said, very challenging, probably because of the different manifestation of the disease, and how can we have similar patient in one trial, because that will dictate what's going to be the outcome often. So to simplify this, we have had really a very promising year. So hopefully the trend will continue to be promising. So I said that a few years ago, we've had Benlysta approved for general lupus, which means almost many manifestations of lupus, including skin, arthritis, inflammation in the lungs, in terms of pericarditis or pleuritis when we have fluid in the parenchyma of the lungs or around the heart. But Benlysta at that time was excluded for central nervous system and lupus nephritis. But more recently, this year, which again, it's a very promising year, we have a trial showing that this drug can be beneficial for patients with lupus nephritis. Not only this, we had also another positive phase 3 drug trial for lupus nephritis, which is a new medication as well for lupus nephritis. So really this year, it has been very promising. And there are as well other promising biological treatment for lupus. So we've got also 3 trials on anifrolumab, and the data is also positive in 2 trials. And the third one, actually, it was positive, depends on which outcome we're looking at. So in general, the conclusion from the 3 trials on anifrolumab is also very promising. And hopefully this will be approved. We're still waiting for the evaluation of the data. And if it's approved, it's going to help us to treat a large group of lupus patients. But also this medication yet has excluded those with lupus nephritis and a severe central nervous system.
Well, that's really truly exciting news for those patients across Canada who we've described are living with a very difficult disease, not just to diagnosis, but to treat and care for. On the non-medication front, do you have some guidelines or recommendations for people as well in terms of lifestyle decisions and tips to help them live better lives with lupus?
Absolutely. And I think one of the most important things is to know about your disease. And I always recommend the patient to start with this. It's an overwhelming concept when we tell the patient you have lupus, and we totally understand this. Even for physician and for the healthcare team, it's a very challenging disease. But it's always very helpful where the patient knows about their disease and we work all together as one team. Because you can prescribe medication, and if you don't explain to the patient why they need to take these pills, probably the adherence to the medication will be less. This is why, again, I'm saying it's a teamwork. We always try as much as possible to explain about lupus, which organ or which manifestation they have, what are the options for treatment. And some critical component of lupus is often if you don't treat and you let go, you might end up with something we call damage, which is irreversible. So for instance, lupus nephritis, it doesn't hurt. And it only you can see it when you do a urine analysis. And this is the challenge when you see the patient, you have to explain that there is something very serious, and probably sometimes we don't do it very well. We should emphasize that this is really a serious problem. And if I don't stop the inflammation in the kidney, might change your life down the road. In 10 years, you might have end-stage kidney disease and you might need a dialysis. So really working together is very important at this level.
That's interesting because I think education, I mean, that's one of the missions of ACE and obviously other patient organizations in Canada. We'll provide some links to those organizations at the end of this discussion, including Lupus Canada. Yeah, I think for patients to know how critical when you're dealing with a complex disease like lupus is, education is, but to also have confidence that that healthcare team is listening very carefully. You mentioned earlier on that as part of your um, outcome measurement research, it also includes patient-reported outcomes. Um, that's a fancy way for our audience to understand what you mean by listening to how patients are feeling, how they are describing what they're living with. If they're dealing with things that maybe aren't as easy for a doctor to diagnose, like pain, like fatigue, like sleep disturbance, like mental health issues. Um, maybe you could just talk to us a little bit about maybe some of the work that you've done around patient reported outcomes, and for our audience to understand that this is something, again, over the last 10 years that has really grown in importance and emphasis, not just for patients, but for the rest of their healthcare team, their clinicians, and for researchers.
And this is a very important aspect as well of the assessment of lupus, because there are a lot of things that the physician cannot measure directly, and you need the patient-reported outcome. Fatigue is one of the most common symptoms, manifestation of lupus, and it's one of the first symptoms that develop probably before we say you have lupus. And we know how difficult can be for the patient. You've talked as well about something very important, anxiety and depression. And our lab and other people have shown how prevalent this in lupus patient, which could be close to 30%. And other manifestation as well, pain and quality of life. So to gather information about this, we provide the patient with instrument. So while they're waiting to see the physician, they fill these instrument, and then the ideal way would be that the physician and the healthcare team look at the results, and that will give you a feedback of what the patient is struggling with in terms of fatigue and anxiety and depression. Because often when we see the patient, it can be overwhelming to capture everything. We spend in our visit 45 minutes to 1 hour. Very rich disease where we spend a lot of time focusing on prednisone, immunosuppressant, how we're going to deal if there is an infection. And we kind of often sometimes don't talk a lot about fatigue, probably, and pain and depression because we're overburdened with many other things. But it doesn't mean the patient-reported outcome are not important. Now, probably we have to be more innovative. There are new tools now being developed, probably some of it electronically, which you can send a link for the patient prior to the visit. And that probably will give you more time as a healthcare team to look at this and have it ready for the visit. We don't have this yet available, but I hope this in the future will be implemented. Some of the promising tool could be Promise, but we're doing ourselves and other people work on validating, on showing that there is evidence on this tool in the lupus management. Then probably if the patient can fill this prior to the visit, and you will have a summary of this in front of you before you see the patient, you can know that I'm going to see now there is an issue with pain, fatigue. So it facilitates things.
Dr. Touma, we want to thank you for joining us today and for giving us a very optimistic message and story for lupus patients in Canada and around the world. The pipeline that you've identified, the different aspects of models of care that are evolving for lupus patients, I think is very exciting and a cause for great hope for these patients. So we want to thank you again, and it sounds like we'll be talking again as these advancements progress. We're going to have you back on the show and give us some updates on this exciting news.
Thank you again for having me. Thank you.
Thank you. And thank you.